Morning guys, and welcome to today's live stream. We're going to be talking all about how you can train your core effectively to help back pain. Does training your core really help back pain? And the answer in this video in short is going to be yes, but it can also hinder your back pain if you do it wrong. So hopefully you guys are going to find this video really helpful. This is perfect for you if maybe you've injured your back in the past and you're trying to, to work your core to build up and provide stability for your back. So you want to avoid you making any of these mistakes. But also if you're in our Back in Shape membership site and you're moving on through the latter stages, sometimes people want to add in different core exercises. Hopefully by the end of this video you'll have a better understanding of how we should train the core if you didn't already. Maybe it's a little bit of a refresher for you so you don't accidentally fall into some of those pitfalls along the way when it comes to core training. It's a fantastic way of stabilizing your back pain, but we just want to make sure you don't make any of those simple mistakes, and they're easily avoidable, but it's also easy to fall into them. So if you're new to the channel, please do consider subscribing. We do these live streams every single weekday. Hit the notification bell so you go live. Today's no different. We've got Lara the other side of the camera. She'll be reading out your questions for the Q&A at the back end of the live stream. So if any of this doesn't make sense or prompts some further questions, or maybe it's unrelated, maybe you've got back pain yourself and you're struggling a little bit and you want a few little pointers, then please do post those in the comments below, whether you're watching us on YouTube or Facebook. And with that out of the way, let's get into today's live stream. So we wanted to make today's live stream as useful as possible for you guys. So I'm going to go through some sort of more concrete tips for you here, alongside a little bit of sort of information and principles. And it's principles that really help you guys because they're applicable to a wide variety of topics, similar to what we covered the other day with regards to those household activities or daily activities. If you've got principles, you can apply them to lots of different things, lots of different core exercises, and evaluate them on a case-by-case basis, rather than just having a list of okay exercises, because sometimes that can get a little bit mundane, but that's that. Now, the first one we want to avoid is the mistakes of building your core wrong. I want to get this out of the way first so you guys don't make the mistakes. And there's 3 common exercises that people will gravitate to immediately when they think of training their core. And if you've got a back injury of some sort and there's sort of disc bulges or disc injuries or spondylosis, spondylolisthesis, we've got degenerative disc disease, sciatica, whatever it is, these are not going to be helpful for you for really a number of reasons. And those are going to be the sit-ups or crunches, the leg raises, and then the worst one of all, which is often the most commonly done or commonly gravitated to, is going to be those Russian twists. And I'm going to explain to you guys 3 reasons why these are not a good idea for you guys, because it's really important that you understand why. Now, first of all, we're going to cover the structure of the back a little bit later, and that will reinforce what we're talking about. But all of those activities that I just mentioned, they involve a flexion-based movement. It is either flexion, which in of itself is commonly one of the causes for these lower back injuries. We've bent forwards with bad form. As we flex our spine, it loses its integrity and therefore cannot load bear as well as it should do. Not as safely either, because the load is heavily shifted towards the front on those discs, and the integrity there's stretched through these structures, so it's less tight, it's less able to bear weight. If we think of someone maybe doing a squat, a heavy squat, that power lifter will really contract down. They'll bind in ready to take on that weight. And when we flex and forward bend the lumbar spine, we're making everything loose. It's not really engaging effectively to be able to load bear just our own body weight, let alone any additional weight. So we want everything to have a nice lordosis, and these particular exercises at the top here do not involve having a lordosis when we're doing them at all. So we're going to lose the stability in the lumbar spine. The next one is going to be the flexion with the twist. And this is the classic one. Many of you will either personally or know someone else who's bent down, for example, in the morning to put your socks on, which involves a forward bend, a flexion there, and a little bit of a rotation. And we just dislocated a joint at the bottom there. That's helpful. A little bit of flexion and a little bit of rotation. And that is a really bad one. It's one that puts a lot of stress on those discs. It weakens the discs as well, and then exploits. And I just want to touch on how some of those disc fibers work, because it's worth noting down the bottom here. With regards to the disc fibers in your lumbar spine, we've got a number of them arranged in order, and then we've got the nuclear material in the middle. This is sort of the jam that kind of herniates out in the future when you have that disc herniation. And if we've got some minor tears and we have a nice neutral spine, let's suppose that this one's torn here. it's managing to cope effectively because all of these are lined up and the weak one is kind of protected. The weak fiber that's a little bit torn and injured is kind of protected by the whole working. And as long as we maintain a nice neutral position, the status quo remains so. But as we twist, we essentially disengage every other one of these fibers. And therefore, let's just suppose that this one gets taken out, and this one gets taken out, and this one gets taken out because of that rotation. And that's partially getting into a little bit more complexities of the structure of your disc. But now these two are the primary load-bearing discs for that brief moment in time, or primary load-bearing ligaments for that brief moment in time as we're twisting to put our socks on. And now the compression from the flexion drives this disc out, and it only has to go through two, one of which is weakened. So it really highlights, or can highlight, the vulnerability in a particular part of your disc, what's called the annulus fibrosus. It's got lots of little ligaments, and as we rotate and compress, it puts a tremendous amount of pressure through there and can expose any weaknesses, which is why that putting the socks on in the morning, a seemingly simple activity that's not too strenuous, is the one that often is the last little one that causes that severe back pain or disc bulge, even though it's probably been weakened for a little while. So it's worth bearing that in mind. And if we're doing our primary ab exercises and they involve that rotation and flexion, then we're going to be getting into a lot of trouble or just running unnecessary risk. And then the second thing, or the third thing, sorry, is going to be a lot of these exercises are very unfunctional. They're not useful in the daily basis in terms of how the core works. And that's what we're going to get onto next. You need to be training your core in the way in which it actually functions on a daily basis. That might be, for example, as you're walking along the road and you miss the step, for example, as you're going onto the pavement or off the pavement, and your body gets swung off to one side. It's your core's role to quickly engage and decelerate that movement off to the side so that you don't injure anything, as your spine is walking along nicely, and then you miss a step and everything goes off to the side. Well, your core here steps in to hold everything steady and your legs soak it up, rather than having an awful bend through the spine, which results in an injury. So we need to train the core in a way that is appropriate. And I've said this time and time again, how many times do you do an ab crunch to get down to pick something up off the ground? Now, yes, bringing your feet up to put your shoes on or put socks on does involve a little bit of flexion and a little bit of ab contraction if we're not flexible enough in our hips, which is another topic for another live stream. But we don't use our core to bend down. What we do when we're bending down is we engage our midsection and we slowly lower with the extensors. We use all of these muscles down here to slowly lower ourselves down to the ground and then lift ourselves up. And the core's role, as you can see on this diagram, which we'll get into in a moment, is there to protect and stabilize the spine in its neutral position. So if you guys have any questions on that, or maybe some other core exercises that you guys have done, then please do post those in the comments and we will cover those or discuss those or break those down a little bit later in the live stream. So how is your back strong? I've already covered this, but essentially there's two factors. There's number one is that we have a lordosis. The lordosis, commonly people will get a bit confused about the lordosis. Oh, I've got lordosis. If a report or a practitioner or a MRI comes back and it says you have a lordosis or you have lordosis, that basically is like saying you have two arms. It's a statement of fact. It's got no real relevance in any it's not relevant from a diagnostic point of view, other than saying yes, you do have in fact two arms, you have a lordosis, you should have a lordosis, it is not a problem. Now if we have hyperlordosis or hypolordosis, that means too much or too little, then it should be measured. It should be measured, and then you should have a quantifiable value of how much too much is. Is it 20%? Is it 20% loss? Is it 60%, etc.? And that allows you to then adjust things. But given normal radiology findings and normal alignment, we have a smooth curve through the lumbar spine, which allows the spine to be strong. And then from the front, which is this diagram here, it should be straight. Now the big problem here is if we do have things like scoliosis, those do make things more difficult. But what I'm about to talk about, if you have any sort of deviations in the spine from the front, any S-shaped curves, this is more important for you, because you will need to overcompensate in the muscles to really protect from that scoliosis getting worse. Because if we have a slight scoliosis, as gravity is pressing down on us, it's going to accentuate that, and that is not particularly helpful for the short, medium or long term, especially if you've got a back injury. So be careful with that. Now, when we're getting now into sort of how the core protects this region. So we've got that nice lordosis. We should not be flattening the arch because of what we mentioned earlier. Flattening the arch is going to destabilize the lumbar spine, load the discs excessively, and is a fantastic way to end up in trouble. So please don't do any of that. I know that there's a lot of classes, and we won't get into it too much, where you will get taught to tuck the bum under to help you engage the core. We won't get into that too much, but essentially that's the reason for that, is to try and help you avoid doing other things wrong. When in actual fact, what we want you to do is engage your core in a neutral position and just do it properly, rather than trying to come up with little cheats or little hacks to avoid certain issues whilst making the prospects of other issues increase in frequency. So we want to really be mindful of why we're being taught these little tips and tricks sometimes, because although it may help avoid one issue, it's not going to help in the long run, because it's teaching you tricks that aren't transferable to being upright. Now, the red here is your core section, and we often refer to it as a corset. It's basically the transverse abdominis muscles, the obliques, and this cylindrical type corset that fits around our lumbar spine and our midsection. It runs from our lower ribs all the way around here, all the way around to the back of the spine. It plugs in along the spine down here, and then it comes around the hips over here and attaches in around this region here. Sometimes when you're doing these core engagement exercises, you're going to feel that it's pulling a little bit on the lower back here and here on the attachment sites, or up here on the lower ribs as well as on the front. You might feel it as well. So don't be alarmed at any of that. That's entirely normal. But that core is there to provide that corset-like protection through your spine, and we should be engaging our core when we're doing any of our exercises to build the core. It's about the core providing that corset-like stability and protection for the lumbar spine. And what does that look like? One of the ways we teach people in the Back in Shape members area, the free area, one of the very first exercises, because it's that important, is the ability to keep the spine straight and relax the stomach completely, and then draw it in like so. So it really provides that corset-like protection, as opposed to being out like that. We draw it nice and in here, and now we have that corset turned on. Note, my spine did not move. I didn't do that, okay, which is so common. That's flattening the lumbar spine to engage the core. If that's the only way that you've been taught to engage your core muscles, then you're going to really struggle, because that means that when you stand up, the only way you can engage your core is by flattening the lordosis. It's not helpful. It's teaching you through a little cheat how to do it, but it's not transferable to being upright. So we want to teach you to engage that core. Why is that so important when it comes to back exercises? Well, if you're part of the Back in Shape membership, you'll know that a lot of our core exercises involve you holding that corset-like stability to provide protection to that section of the spine, so that when we're doing other exercises, be it, for example, some of the dead bugs that we mentioned before, where the leg is going out, we're creating a pull on the spine, a pull away from the neutral position. And the role of the core here is to stabilize the spine, so that as that leg's going out that direction, if we put the leg in here, somewhere around here, there we are, as that leg's going out like so, and it's pulling the spine into extension, it's pulling the spine off center out of neutral. Our core is there to work effortlessly and effectively to stabilize and protect that lumbar spine. And that, if you've got back pain, is something that's so important. If we can stabilize the spine in spite of it being pulled in different directions, that's going to give you true stability and true protection for that lumbar spine in the medium and long term. And then over the course of a program and a period of time, you're looking to increase your core's ability to maintain stability, to maintain balance. Just like the rest of our body, we're always trying to move back to a state of balance, a middle stableness. And that's what we're doing with our core when we're doing these exercises. We're providing a state of balance, coming back to the center in spite of forces outside of our body pulling us off in different directions. And that's really the key to the core engagement exercises. So that's doing things like our dead bugs, some of the other exercises that we incorporate that involves the core holding a nice neutral position whilst we're being pulled in different directions. So hopefully that's been helpful. I think we'll just recap things very, very briefly once more before we go to Q&A. So if you've got any questions, then please do post those in the comments underneath. First and foremost, Don't make these mistakes when you're building your core. If you're someone who's had back pain in the past, or you're coming out of back pain, you're doing well with your rehab, avoid these sorts of exercises because they have no place in a core engagement program. Do other things that are more fun rather than trying to add these in to make things more difficult. We've got things like sit-ups, leg raises, and Russian twists, which all involve forward bending, and they really do expose those discs in particular when we're talking about core exercises and back pain. We want to avoid flexion with twisting, and exercises that are functionally quite useless because they're not going to train your core in the right way, and they're not going to get you geared up for daily life in terms of the stress and challenges that your spine may take when you miss a curb, when you have to carry something, when you have to move your child in and out of the car seat or do some gardening. They're not going to help in those scenarios. We want to make sure that we're maintaining, when we are doing our core, a nice neutral curve in the spine, and we want to maintain straight from the front. We don't want to be leaning to any side, and we want to use that corset-like strength, that corset-like contraction to engage around the entirety of the lumbar spine to provide protection and hold us in that neutral position, and then embark upon those exercises that we're doing. And I've mentioned in here obviously the back in shape exercises that we do in phase 2 and phase 3, and those really follow these principles, and you will find that they do work your core. They work your core in a productive manner, and you really will build some core strength and not injure your back in the process. So we're going to Q&A.
Okay, brilliant. Good morning, everybody. Right, I'm going to go straight into Facebook for a couple of questions. So Alex Vesco has asked, are planks safe? Also, I used to do a star balancing on one leg and one arm, the corresponding limbs opposite in the air. Would it be okay to go back to that?
So on the topic of the plank, I generally say I probably would leave it out, to be completely honest. There's other ways we could do those sorts of things. Yes, later on when you're stable, when you're in a position where you're doing really, really well, you can introduce a plank because it's a static hold, but we must be mentally very, very aware of if we're losing our alignment. In the early stages, and I really would say for 3, 4, 5 months or so, maybe even up to 6 months, I would leave planks out because a straight plank on your front massively increases the intradiscal pressure at the L5-S1. So if we have any vulnerabilities down there, Alex, particularly that L5-S1, we are going to load that disc a little bit more. So I would steer clear from planks. Now, things like those star raises, etc., that you've mentioned, being on all fours, there are little exercises similar to that can actually be quite good, but again, the same process is true of those as of the plank. They are very advanced exercises, and if we've got any weakness, we have to remember that the disc material in our lumbar spine, the ligamentous structures around there, do take a long period of time to recover. So we're talking about a good period of months before we might challenge or might test some of those more challenging exercises. But again, if you're working towards that principle of holding the spine in a neutral position and engaged, then those particular exercises, I believe, do not involve any particular rotations. It's all about a static hold. So I would say they would be okay for the future. Much, much better than something like a leg raise, Russian twist, etc. So okay, but maybe a little bit premature, especially the second one.
Okay, brilliant. He said great explanation. Thank you.
Awesome.
On
Good
YouTube, Joe has asked, I find yoga really helps my back, but we do a lot of twisting and forward folding. Is that going to irritate my herniated disc?
Yes. We've had a few discussions, I think in the clinic more than on the live streams recently, about yoga, and yoga is it's got loads and loads of great benefits, but yoga is a skill. It is a activity that requires a high level, much more than the average degree of flexibility in a number of joints, hips, back, shoulders, etc. And for someone with back pain to start embarking upon those activities is like taking up elite trampolining. You just will not have the flexibility or the durability or the skill to be able to do these exercises effectively. And if we are doing these rotationary exercises with forward bending, I really would encourage to leave those out. Focus a little bit more on exercises that are going to improve the flexibility of the hips in isolation, rather than gross movements or yoga flows that involve the lumbar spine, because they're likely to shine a light on certain weaknesses that you may have in the area in both flexibility and strength, and therefore lead to a bit of trouble. So I think you're better off preparing. Maybe if yoga is something you want to get back into, we need to have a look at some of the flows that you're going to end up doing in the future, and look at, okay, what flexibility do we need here and what strength do we need here. But for most people with back pain, they need to focus on strength first, and later on they can build back in that flexibility once they've got a bit of strength. Because if you build up more flexibility and you don't build up strength, you now have a more wobbly structure that you need to contend with, and that requires muscular energy to be expended to provide support for that. We see this a lot in hyperflexible people that have been dancers or gymnasts in the past. Once they lose that natural strength that they've had during those activities, they really do start to struggle with that hypermobility. So we want to be mindful of that.
Okay, Pauline has asked here, as a woman of a certain age, I am quite thick around the middle and have bursitis in both hips. Will aerobic exercises and walking help with the lower back pain?
No. So aerobic exercises and walking, they're not really going to help with the back pain, and if we're doing excessive amounts, they could potentially be a little bit problematic for the bursitis, because the bursa there is there to protect. It's there to basically smooth the process of your glutes rubbing over. It's kind of the bit on the side here, I'm guessing, down here, this bony bit here. Well, there's tendons that glide over one another, so doing lots of walking is going to cause more rubbing over that particular bursa than not. You might want to get some ice on that area to help calm down the inflammation, but I would suggest that doing the sort of the resistance-based exercises are going to be more helpful for you in both endeavors, both losing the weight and protecting the back.
Okay, awesome. Alex, I will get to your question. I'm just trying to do them in a particular order. Jono has asked, is walking again good for back strengthening?
No. This is a really big mistake, and I think we probably need to do a dedicated live stream on just why walking is really not helpful. We did cover briefly about muscle strength, resistance, and balance in one of the live streams that we did on balance. And too many times, people, as they move into sort of their 40s, 50s, and 60s and beyond, they start to rely on things like walking. Patients will come into the clinic and say, "Oh, well, I do walking to stay fit. Is that okay?" And that's fine for cardiovascular if you're going to do that, but it is not doing anything at all to provide a remedy for the weaknesses that are involved in back pain. We need to be doing some resistance-based exercises to help us in building strength and stability for that back. And yes, walking has a place. We always recommend to patients to do a little bit of walking, especially in the early days when they've got back pain, because it is a good means of mobilizing the spine, but we need to do a dedicated resistance program. And the great news is, it doesn't matter how old you are, you do have the ability to reactivate some of these muscle fibers and get them working again and build them. It just takes a little bit longer than when you're in your 20s, but it is definitely worthwhile doing, because it will protect your back for the long term and mean that if you do ever have any accidents in the future, falls, knocks, anything like that, you're going to bounce back an awful lot faster than the person that has just been doing walking to stay fit, because walking is not efficient. It's not a well-rounded enough exercise.
Okay, awesome. And just a couple of new names asking questions. So if you're not already a free member of our Back in Shape program, you can always sign up. Phase 1 is completely free.
Yeah, there'll be a link probably in the description already.
All right, Alex, next question. So the Phase 1 psoas exercise, which part of the psoas muscle does it engage? Alex Sparks.
It's going to be, well, okay, so you could say you've got the iliacus, so you've got the iliopsoas muscle, which is basically this muscle here. It comes from here and then goes down, and then you've got the psoas part, which runs from here down. The reality is we can't engage individual muscles. When we're doing these sorts of exercises, you're going to be using the whole thing. And you're going to be using, when you do that exercise, you're not just going to be doing psoas, you're going to be using a bit of rectus femoris, any muscle that involves, I think this is the great thing about our body. We don't have one muscle that will move one joint. We have numerous muscles that work in tandem with one another to stabilize the motion. The fact that you're moving it through the middle, you're not allowing the leg to fall out, means that at the same time as you moving the psoas up, or using the psoas to move the leg up alongside the rectus femoris, you're also using a bit of sartorius, which is another muscle that runs across the front of the thigh. You're also using your adductors, if we just point on me. So we've got your adductors on here, which are stopping your leg from falling out, but there's also a tension between them and your glutes, which stop your legs from falling in, all the while as you're bringing your leg up towards your torso. So none of these exercises are purely isolational. Obviously, psoas is the major muscle that we're working there. It's the one that people can most likely relate to, but it's much more complex than that in terms of the way in which the human body works. These are built-in mechanisms to protect specific joints from functioning. If they only have one muscle that works them, then they're going to get in trouble.
Okay, awesome. Just following on,
Hope that makes sense.
Alex has said, so the psoas muscle is a very long one. So is it the whole length of it, that's working? Yeah, you can't.
Muscles can only contract or shorten. You can't kind of say. Imagine your bicep. You can't say, I'm going to move this part of the bicep in here. here. All you can do is contract those motor units. Unless we've got a fulcrum in the middle, etc., or a tendinous insert halfway through, the whole muscle either contracts or it lengthens. That's quite simple.
Yeah, I think you explained it really well the other day when you were talking about the web of muscles and fascia and everything, and the way that when you are working out, you are using everything that does that particular movement. Very difficult to specifically isolate a muscle.
No, it really is. And definitely in terms of isolating part of a muscle, you can't really do that.
Okay, awesome. Let's keep going. So Keith has asked here, what is the best way to get up off the floor without twisting?
We did a video in the premium membership for that particular one, so definitely check that one out. But in essence, we want to do it in a way that is not, it's a bit practically difficult for me to do that, but we want principles. That's why we talk about principles. We want to do it in a way that is not going to lead to bending of our spine. All too often people will get into that child's pose where they round their back after they've got onto their front. Try and roll onto your side and use your arms to get up. If you're doing the exercises on the floor, then do them next to the bed so you've got that support to help lift yourself up off the floor with a straight spine. We should be using our hips and our leg muscles to help us get off the floor rather than rounding our back excessively. Keep your spine neutral. Imagine someone's tied a broom handle from here down to your bum, and that's going to stay nice and still the whole way through that movement, getting up off the floor, and that is going to be the best way for you.
Okay.
And engage your core.
Okay, Joe's come back. She said, I find after doing I find after doing bridge strengthening work, my glutes tighten and that pulls and irritates my back. What am I doing wrong?
Nothing. You're not doing anything wrong, I suspect. You've just been working your glutes. As a personal example, if you didn't know already, I've probably mentioned it more than enough times. People are probably sick of hearing about it. But I went to the gym for the first time in 4 months the other day, and my legs are stiff and restricting ranges of motion, and it's just pulling up there because once you've worked those muscles out, they're tight. So we always recommend to you guys to, at some point later in the day, normally immediately after, but you can also do it later, to do some stretching work on those glutes, because once they get DOMS, they get that little bit of soreness and tightness, delayed onset muscle soreness in those muscles. It is going to have a limiting factor on your lower back. And one of the important principles that we cover in the Back in Shape is that we must have good flexibility in this hip joint here so that the hips can function effectively to move the spine around rather than the spine having to do it. As soon as we finish a strong, maybe it's some bridging work, etc., and our glutes and our hamstrings tighten up, it means that they don't quite move as well, so our spine is having to, and that is what you're feeling right now after doing that working out. So we're maybe not doing enough in the way of stretching, or we're just going through the natural process of being a little bit sore afterwards. I know that my movement is impaired a little bit as a result of that first workout, but the good news is as your body gets stronger, as you get more able to recover from these sessions, and as your body adapts, you get less longer term soreness after the workout, and you'll find that it will have a lesser impact on your general flexibility. And obviously little things that can help. We use the vibration gun that's here. I've been using that daily more recently, just to make sure that my hips are as flexible as possible, even though it's a little bit uncomfortable to do at the moment because of that soreness after the workout. So it's definitely it's definitely something that's normal. Don't worry about it, but we want to be conscious that after we've done those workouts and our legs do stiffen up a little bit, we want to do a little bit of stretching, maybe some vibration if you've got something like that around the house, to make sure that we are a little bit more careful in those few days afterwards.
Okay, awesome.
And a little bit of ice on the lower back doesn't go amiss.
Marie just jumped in and she said, thank you, that was my question answered. Brilliant. Okay,
awesome.
I'm going to move on to Facebook now. Keep them coming, guys, because we are, the Q&A is for you. We want to help you as much as possible.
Yeah.
Okay, so Joe has asked here, how hard should the phase 2 or 3 workouts be? Are you likely to be in pain or sore the day after these?
I think that entirely depends. We get some people that come in, they're generally healthy, active people that have been doing gym work or whatever in the past, and they start the phase 1 and the phase 2, and maybe it's a little bit difficult and there's not too much in the way of soreness. Maybe there's a little bit of soreness in some of the muscles that they haven't worked before because they're not used to doing them. But they can do all of the necessary reps. Maybe it's 3 sets of 10 and they start on that quite comfortably. There's a little bit of soreness the next day, but nothing too untoward. Others, however, struggle to even lift their leg up properly and effectively without losing the core engagement. And if this is you and you're struggling to do 2 or 3 reps of those exercises, we often recommend, in fact, that when you move into phase 2, you do phase you do your phase 1 in the morning, you do your phase 2 in the middle of the day, and then your phase 1 later on in the day, because we're keeping those hips flexible, remember? We don't want to tighten up like we just mentioned in the last question. And then the next day, we would just do all phase 1, working on the flexibility, icing, etc. And then we'd go the third day, we'd go back in and do phase 1, phase 2, phase 1, and that is often necessary. Remember that these workouts are designed to challenge our body, they're designed to stimulate those muscles, and there will be a little bit of muscle inflammation after these workouts. That is exactly the process that we need in order to build muscle. So they should be challenging. They should be working you quite hard for you. So if that means hard for you is 3 reps of the dead bugs, for example, or 3 squats, then that's okay. It doesn't matter where you start, but you might feel a little bit of soreness afterwards, which is why we suggest that easing yourself into the phase 2 rather than going in full hog. But with time, you'll find that soreness decreases and you can do more with less soreness. So that is sort of where it should be. As regards to the overall intensity of the workout, you guys have probably seen, if you're in the phase 2 stuff, you've seen me going through the workout, so that kind of gives you a gauge for how intense it should be. The phase 2 and then the phase 3 should be a little bit of a cardiovascular workout once we've got the technique right. Maybe it takes you a week or so just to get the technique right on all of them, and then you can start enjoying the routine, and that means it should be a bit of a physically arduous workout as well from a cardiovascular point of view. Okay. And the phase 3, both of the new phase 3 workout, which we shot the video for yesterday, that got me pretty tired, yes. Which was good. It was good fun, and I was a bit sore, as I said. So yeah, it's great.
Hot weather didn't help.
Yeah, this temperature right now is quite a lot.
Okay, all right. Kate has asked here, following a certain medical routine I still get abdominal cramps when doing the core exercises. Is it still that my core is not strong enough yet despite doing the exercises, trying to strengthen more, doing the core throughout the day as well?
Okay, so that I think the reaction that you're getting in the core is actually okay. The mistake we're making here is if we're doing more of the core exercises. So you were speaking to someone on the phone the other day about they'd done two lots of the phase 2 for the first time, yes. And then the next day they're in a lot of trouble. Guys, remember, and this goes back to something that I briefly touched on one of the earlier questions, work out in one period of time. So especially when we're doing phase 2 stuff and we're trying to get things stronger, do your workout in your workout's time, but then it is the recovery process that's getting you stronger. Sometimes people will do multiple phase 2 workouts because they think, oh, well, if I do more and more and more, it'll be better. And that's not necessarily the case. We've set out a clear structure for you guys to go from 3 sets of 10 to 5 sets of 10 to 5 sets of 15, not 3 sets of 15 first. 5 sets of 10, then 5 sets of 15. There's reasons for that because it slowly ups the intensity. And if you're doing that one workout a day, you're allowing your body, you're getting your good nutrition on board, maybe your vitamins, your protein, your good quality diet from food, etc., adequate hydration, adequate sleep. And it's those other practices outside the workout that allow you to benefit from the workout. That is so, so important. So overdoing it, going, oh, do you know what, I'm really struggling with the core engagement, or my core is very, very weak, maybe I could only do 1 or 2 or 5 of the dead bugs to start with, saying, okay, well, I'm gonna do the dead bugs 5 times a day. That's a little bit too much. You're not giving your body time to recover. We need to tone it back a little bit. Think about the intensity that you might have done in the gym or physical activity as a child. When children go into sort of rugby or football, etc., they do 1 session a week, and it's sort of 30, 40, 50 minutes of training, or games are shorter. And then as they go through their teenage years, they then start to do more and more training. Well, if you're just getting it back into the core and you're struggling with it, and you've got a long way to go in terms of strength to get to an adequate level of strength, don't overcook it by doing more than what we recommend.
Okay, Pauline has asked a really good question here. What are the indicators that you are ready to move on to phase 2? And once just answering that, can you also just maybe recap for everybody the combo, i.e. doing phase 1 in the morning, phase 2 around lunchtime, phase 1 in the evening again?
Yeah, sure. So with regards to phase 1, the phase 1 is there if you're struggling to get out of bed. Like if you can't get out of bed and leave the house, you're in that much trouble, then you need to do the phase 1. And phase 1 is also there as a relapse routine. So if you do overstrain it, you have to run for the bus, or you have to, I don't know, some accident, then phase one is 100%. You drop back down to that. And many of you guys along the way know, I think we discussed it the other day in the mental health one, that there are bumps along the road with back pain and recovering, especially if we've got more complex conditions there in the background. So the phase one is for that. If you are, but the problem with the phase one, or not the problem, but the characteristic you need to be mindful of, is that is not changing anything from a strength point of view. Often people are very anxious about getting into phase two. Phase two is necessary. If you can walk for 15 minutes or so, if you can go up and down the stairs during your day, then you need to be doing phase two. It's going to be challenging, but the exercises are there with the instruction, and as long as you do those exercises technically well, they will be fine for you. It may be difficult to do them technically well, so you will need to persevere, but there is no reason anyone at all with any condition should not be doing those exercises. Those with more complex conditions, we've mentioned before, one in particular, spondylolisthesis, which is a little bit more of a severe condition, and that's where we've got a little bit of a forward shift in the spine. That's a problem if you do the dead bugs wrong, which means that you must focus on doing them correctly. And therefore, if it takes you a little bit longer to get used to the technique, that's okay. But we do need to move into phase two, because it's only with phase two that we start to build strength and stability in those muscles. And that is what is protecting you from future relapses. And that means that if you do have a few bumps, you're not going back to square one because you've made some strengthening improvement. So phase two is really where your recovery starts. Phase one is sometimes just necessary to get you out of the bed and into doing some sort of physical activity.
Okay, brilliant. I hope that helps, Pauline. Karen has asked, now that classes are open, back up and running at the gym, is Reformer Pilates a good class to join?
Yeah, I mean, we always, in the clinic anyway, we say that Reformer Pilates is a good one. Obviously, they need to be aware of your condition. There's nothing wrong with that. That's generally what I would recommend from a Pilates point of view, because that's why we recommend you guys to use the bands in the phase three, because using resistance means that you don't need to use gravity, and it makes things a little bit easier to enhance your workouts.
Okay, brilliant. Just on classes, I wanted to ask a question about, you mentioned about flattening the lordosis and not doing that when you're working out. In my body pump class, when we're doing chest press, we're told to flatten the lordosis doing chest press. Is that wrong?
So the reason that you're told, so this is always helpful, and in things like the Reformer Pilates, you'll probably, if you do that, you're probably going to be told to flatten your lordosis. And this is why we try and drum these things into you guys, so you can understand it, so that you can take a good exercise and just slightly tweak it so it's more applicable to you as an individual, because these guys that are recommending these classes, for example, are doing it for different reasons. So if we take the flattening lordosis in the example of a Pilates, the reason they're trying you to flatten your lordosis is so that you don't do that. Okay, but you cannot do that, extend, if you just hold yourself in neutral. It's about building strength. It's just easier to do it if you tuck your bum under, but that's not applicable to real life. With regards to the example there of lying on your back doing the chest press, the reason that they instruct you to flatten your back to the ground is to do with engaging the chest muscles. When you do a chest press, there's a natural tendency to arch your back because it helps stimulate the lower part of your chest. It helps you work that section of your chest muscles. When you're doing those classes, they want you to isolate probably the whole of the chest girdle, including the shoulders. So by flattening your back to the ground, you're able to more effectively engage the upper part of your chest, the top section here in through the shoulders. So it's nothing to do, they're not telling you to do that for your back, they're telling you to do that for your chest in order to get a better chest contraction. So it's always worth understanding these things, and that's why a question like that is really, really helpful, because that's nothing to do with your back. And actually in that particular scenario, the weight isn't going through your back anyway, so it's not going to be an issue for the spine.
Okay.
But if they were to tell you to do that and then do a crunch or a leg raise, that's another kettle of fish, because there we are involving the lumbar spine.
Brilliant. Okay,
hope that makes sense.
Yeah, no, that was really great. Okay, brilliant. Yes, some people just saying yes, thank you so much. Good recap on this session.
I'm glad. Yeah, that's kind of why we wanted to do it, because I know some people, when they start to get, you've been out of action for a little while, you want to get back into physical exercise, and you want to just add back in some things. You think, I'll do some sit-ups. They're okay. They're easy, and we just want to make sure you guys don't fall into traps.
Just wanted to mention on the live, just because I am going to the post office today, we did launch the multivitamin yesterday. Yep. So if anybody wants to place an order for the multivitamin, please do so before 11 o'clock, because then I'm going to go to the post office and post those out to you today.
Yeah, so that's an hour and a half or so.
Yes.
Yes. And any other questions?
No, that's everything. Alex just said, have a really great day and have a
You too.
great weekend,
Enjoy the
guys.
sunshine,
Also,
everybody.
thank you so
It's a lovely day here. Or it's going to be maybe not so lovely later on in the day. It's going to be pretty hot.
Really hot,
So
yeah.
enjoy yourselves, guys. We've got some vitamin D today anyway. That's going to be good for us. Hopefully you found this live stream useful anyway today. I know for a lot of you guys it's going to be a little bit of a recap, but hopefully one that has been helpful. If you're new to the channel, please do consider subscribing. We do these live streams every single weekday. The Q&A at the end of the live stream is there to help you guys, and it's great to see so many of you asking awesome questions today as well. They help not only you who's asking the question, but they help many others who are watching this either at the time or after the fact. So we do know a lot of you guys watch this after we've done the live stream, so those questions are super helpful. We can't think of all the questions you've got, and that's why we really appreciate you guys taking part, and hopefully it's giving you guys some really helpful advice. So have a great weekend, everybody. Enjoy the sunshine this afternoon, and we will see you on Monday with another live stream. Have a great one. Take care, guys. Thanks so much for joining us on today's video. Hopefully you found it packed full of useful information. If you want to learn more about the premium Back in Shape membership, there's going to be a video somewhere underneath here. And if you want to stay up to date or tune in to some of our more recent live streams and the Q&As at the end of those, then that's going to be down here. And remember, you can subscribe to the channel up here and hit the notification bell to make sure you know when we next go live, so you can join us for our next live stream and Q&A.